healthcare companies today acquire data and partner with an ecosystem around them. And so over the years, what they've done is that they've collected data from very many of these disparate data sources and brought it in-house for consumption. Now, some of the examples, if we were to take, so for example, a claims manager at a health plan will work with a member and typically sort of curate and work with the member to come up with what is called as, say, medication list, right? A similar interaction occurs oftentimes as well when the member or the patient goes up to a pharmacy and to get their prescription medication. And so now there's similar interaction that occurs between the pharmacist and the patient. And the pharmacist is looking for things like, the drug-to-drug interaction and things like that. And so the pharmacist also produces a sort of a curated list, if you will, or a medication list for that particular patient or member. Now, there are two of these lists, and depending upon, if there are connections to both of these sources, the health plan is getting this information or any other health organization is getting this information. They're now trying to figure out, and these happen in different points in time. Most of these are not in real time. And so now you have an issue of inconsistency, not having merged these lists, and having duplicity of data. And so I think one of these big issues is that the healthcare companies have disparate sources and disparate data sets that are sitting with them from a legacy standpoint. And so I think, so the question first is, how do you take this legacy, and as you transition to the cloud, how do you refactor, and what do you do about it? The second example that comes to my mind is, when there's data or information coming from different sources. For example, there are claims coming from a health plan, lab coming from lab, and then some information coming from the provider. All of these three pieces of information are interesting for analytics. And so today the health plans combine this information to produce data sets for interesting insights gathering, analytics, business intelligence, and so on. Now, when you move to cloud, again, you're thinking in terms of dependencies between these 3 or 4 or 5 different data streams that are coming in. And how do you sort of plan it such that you take cognizance of these dependencies and really move all of this information to the new platform so that it's now available for analytic use. You are able to transition your analytic application. So a number of these things the healthcare companies would have to keep in mind as they transition to the cloud, in terms of sequencing, in terms of dependencies, in terms of inconsistencies, and really being able to refactor all of this information as they move forward and plan it in a certain sequence.